everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and in this week's episode, I'm pleased to introduce Dr. Melani Silvestrini. She is a cosmetic dentist in Miami, but also a Miss New York contestant. Yes, she is the epitome of both brains and beauty. She went to Tufts Dental School for her general dentistry education and then went on to do residency in Northwell Health Hospital. Now that she's in Miami, she's not only a practicing dentist, but also a podcast host of Dental Talk 360, where a patient centered approach is taken to explain common dental topics with other dentists from all over the US. In our conversation, we talk about how to unlock your full potential. We talk about misconceptions of dentistry and the importance of patient education. I hope you enjoyed the episode. Hi, Dr. Melanie. Thank you so much for being here with us.
Thank you for having me.
Of course. Dr. Melanie, you are the epitome of brains and beauty. You are an accomplished dentist.
Thank you.
It's true, you're an accomplished dentist, but you're also a beauty pageant contestant. And that, takes a lot of responsibility because there's a lot of women out there, young girls out there who look up to you. And I remember being a kid watching these shows in awe and fascinated by these women. So I admire you for that. And I'm kind of like
Thank you.
celebrity, like starstruck at the moment.
Oh, thank you so much.
But so I want to know for you, when did you decide that you wanted to take on that big responsibility, that big role? And was this before or after dentistry or dental school?
Yeah, so similarly, like yourself, I did look up to these women that I would watch on Miss Universe, and I did grow up watching it with my mother, my grandmother, and you know, I knew I wanted to be a dentist since I was 7 years old. So a majority of my adolescence and early childhood was revolving around how can I become a dentist? How can I get into dental school? And how can I just get through this career endeavor of mine? And so it wasn't until my third year of dental school where I encountered an advertisement for Miss Massachusetts USA, part of the Miss USA Miss Universe venture. And I remember I was just sitting in my room at the time. I had two roommates, and it was late at night. I saw the ad, and I thought to myself, "Oh, I remember watching those things when I was younger." But I realized how consumed I got in my career and dental school and everything else that came with it, with all the responsibilities of, entering this field. And so it asked for a little blurb about myself in a photo. And I thought to myself, okay, well, you know what? Click. I wasn't even thinking, I was kind of just acting. And I think that action was coming out of a place where I once was, a curious girl who had this interest once upon a time that kind of forgot about that because of the career that I was trying to pursue and, all the energy that was putting towards this. So after submitting, I got a phone call, and this was the same night. I had a phone interview immediately, and I remember my interviewer was very intrigued about how I'm a dental student, and they thought I could do very well in this pageant and in this venture. And so they wanted to meet me in person. I went in person. I actually went in my scrubs. It was pouring rain. I was actually all wet. I was late from clinic. So I was a hot mess, and I was just like raw, authentic Melanie, and they loved it. And they thought, wow, we need more of this, and we would love to have you. And so it wasn't until that experience where I thought about my childhood. I thought about a little past passion of mine that was kind of something that was like inside of me that I wasn't able to really get out again because I was just so consumed. So that's when I first started everything. I then moved to New York, my home state, after graduation. I did residency there. And then I did Miss New York USA, which I ended up doing twice. I just recently competed for my last year. There's an age requirement, so I did retire, but we can talk more about that.
Yeah, congratulations on that.
Thank you.
It's a big deal. It's huge. It takes a lot of discipline, and
Yes,
both dentistry and pageantry do, as you know. And
exactly.
I and there's not a lot of time in dental school, so I can see like how this happened a little bit after residency. But
Yes.
because it takes a lot of discipline, is there like a motto or principle that you go by?
Yeah.
And do you think there's value in having discipline, and what helps you stay on track?
I think discipline is so important. I also want to make mention that your career should not define you. And I think a lot of people get consumed in that concept
Right.
because it does take a lot of your time. However, I think it's really important to also remember that you should be willing to go forward with fulfilling your potential. And this
Mhm.
goes for anything in your life, anything in your career, and anything that really ignites your passions. So I just wanted to say that because that's something that's my motto. It really is. And when it comes to the discipline and the hard work, how did I stay on track? I had an end goal in mind. I always had an
Mhm.
end goal, and having an end goal is really, really beneficial for someone to just keep on track and make sure that they can get to their end goal. So that really helped me during the process when I was probably the busiest I could have ever imagined in my third year of dental school, you
Right.
know, about to exit clinic, just doing everything I could possibly imagine. And I also didn't realize all that came with the preparation process for pageantry. You
Mhm.
don't know until you're in it, and
Right.
especially if you want to do it right. And so I did have coaches. I worked with a trainer. I was working in every aspect of my life: health, fitness, personal development. When it came to interview, what are my core values? Can I back those core values up with examples?
Right.
And so it's a lot of you thinking deeper about yourself,
Mhm.
who you are, what you want to provide, and the value you want to bring to this world. A lot of the discipline really came with time management,
Mm.
calendar, blocking out my schedule, planning a week ahead, and being very determined and looking at the end goal.
Right. I think a calendar or a to-do list is really important. I took that on upon myself during dental school to make like
Yeah.
an actual checklist, and the me crossing the list off gave me satisfaction, but
Yes.
also gave me like a sense of like progress,
Right.
like I'm moving forward. No, that's um really, really important. And when you said a lot of really good points that I want to go back to, and one of them was about personal development and
Yes.
personal growth. And you know striving for success, striving for perfection, that happens in dentistry,
It
and we always
does.
want to do good dentistry. And then we lose this lack of self because we're so focused on being a good dentist, we don't
Right.
invest in ourselves.
Right.
So how important is personal growth to you, and how did pageantry allow you to do that?
Personal growth is so important, and it's something that you can't really rush. Honestly, I think a lot of my personal growth came with experience
Mhm.
and being willing to put myself in new situations that not only intuitively felt right for me, but ones that would test me, ones that would challenge me. And I was always getting out of my comfort zone. I think that is the number one most important thing that people need to remember is you're not going to grow if you don't get out of your comfort zone.
Right.
And so personal growth came with experience, but also with the preparation progress process for pageantry, because the pageant interview is actually very intense. A lot of people don't realize, but it's only 2 minutes long. And you have 2 minutes to answer any question that comes your way. And you
Mhm.
need to navigate that question to display one of your core values, why you deserve to be title holder out of all the 200 plus girls who are competing with you.
Right.
You have to be so self aware in those 2 minutes. And with that comes months and years of practice and growth. Now, since I competed 3 times for a Miss USA pageant, I was able to reflect on the year before. And
Mhm.
each year I noticed not only did I grow with experience in the pageant system, but I also grew with experiences that helped me become who I am today. And it came with a lot of hardships that I endured, that I encountered, and how I overcame them. And reflecting upon those hardships really helped me develop more about what I want to give out as a message? What do I want to portray? And how do I want to have a positive impact on society? And so, a pageant system, you have to think, okay, if I'm title holder, what platform am I going to bring? What do I want to be known for? What are people going to look up to me for? And that is a huge part of the preparation process as well. So it's all very connected.
Where did you find, I guess, the confidence to move forward? Because I feel like once you have, a failure or a mishap, or, you feel like you're deviating from one side. So when you feel like you're deviating from one position, like you're a dentist, but then you have to step back and focus on pageantry, and then you're not focusing
Yeah.
on your professional career in that aspect, and you might feel like you're, losing balance. How did you overcome that fear that you're, getting off track?
Yeah, that's a really good question. In the beginning, I will tell you, when I was in dental school and I first signed up, I decided to sign up, I got sponsored, everything kind of fell into place. I was a
Mm-hmm.
little hesitant to tell people that I was going to compete because I wasn't sure how people would take it. Because all in all, I'm a dental student and I'm on my path to becoming a dentist. And there were just a lot of misconceptions about pageants in general that I didn't want to I didn't want people to think that I'm not taking my career seriously because I'm pursuing
Right.
this other endeavor on the side. And in addition, a lot of it came from what I could not only gain from the pageant, but what I could provide from that larger circle of influence and that platform. So even though I knew that, it was hard for me to portray that and demonstrate it to others without just doing it and just not listening or just, just kind of going upon this venture myself.
Right.
And that's what I did in the beginning. I did tell a few people, and I remember, you could think, intuitively when someone's like, oh, that's interesting, like
Right.
I wasn't getting that positive feedback. While no one was saying anything negative, no one was like, "Oh, that's amazing."
Right.
It wasn't
Right.
until my second time around where I did New York, my home state,
Mm-hmm.
and I was coming again. I already knew how to go about the preparation process. I hired even more coaches, and then I was starting to get more positive feedback because I guess people saw, hey, like this is connected. She was able to connect this to her life, her career, and she did it with poise and she did it professionally. And so I kind of had to just prove that in the beginning, but I don't want to get off track. I
No, no,
kind of
it's
think I'm
fine.
getting a little off track, but
No,
regarding your
please keep
question,
going. Yeah.
did I kind of answer a little
Yeah,
bit?
absolutely. Keep
Yeah.
going. Yeah.
Yeah. So primarily in the beginning, it was just I did it for me
Mm-hmm.
and I knew what I could bring and the value I could bring. And so I didn't let anyone's opinion deter me from achieving my goals, my passions. And to this day now, I definitely have been portrayed as a role model, not only as a female dentist, but also as someone who's not afraid to pursue other passions. And
Mm-hmm.
it's really nice that some younger females reach out to me, not only about getting into dental school, but also, hey, I would love to do a pageant one day too. How can I go about doing that? And it's something as simple as that I was able to reach someone who is starting their life in a way, their
Right.
adolescence and their personal growth and development. And for me to be able to have some sort of impact where I can fulfill someone else's potential just through the experiences that I've had and through social media, through demonstration and portraying everything I've accomplished, I think that's just more fulfilling for me at the end of the day.
Absolutely. To have that kind of impact on someone else, especially that influence on a young individual where they're looking to grow, and
Right,
you can influence like the decisions they make and the progress that they make. That's a big
right. And
win.
it's not just with pageantry, it can be with
Right.
anything.
No, that's true. Even with dentistry, I mean, like the patient connections that you form, it also has an influence. But when you were saying, when you were first sharing this whole new part of you with your friends in dental school, other dental students, and there was like
Mhm.
a lack of, appreciation, or there was not really a warm welcome to the idea.
Right.
And it's so much because in dental school, it's so competitive. I feel like everyone is just rushing for that rushing to be good at clinic. Everyone's trying to like
Mhm.
outdo the other person. And it's a really like dog eat dog world in dental school. We, we all strive to be the number one. And I don't know about your school, but my school is very, everyone was like hush hush. No one shared any like lessons or secrets, or
Oh yeah,
everyone kept to themselves.
very, very
And
true.
yeah, and so to see someone else do something that's not dental related, it's like, oh, they're wasting. No, I don't mean this in any negative way, but like
No,
they're
of
wasting their
course.
time. It's
Yeah.
like they're
Oh,
wasting their time.
100%.
And
And I
it's really,
really,
go
yeah, I
ahead.
think that's just something that it's unfortunate. It probably still exists to this day, but I hope it's people like you and me, bringing out this message to really get out and at least touch one other person so that they can either not have that negative influence on someone else, or they themselves can not be afraid to pursue whatever they desire as well. It's all
Right.
about balance.
It's all about balance. I'm all for balance, and I'm one of these people who's a little bit more free spirited, a little bit more flexible. I try and travel as much as I can to connect with as many people as I can. I'm up for any adventure. But
Mhm.
when in dental school, when I saw all these people be so focused on school, that
Yeah.
when we got to the end of it, it was like we were like looking to get into school, then we were looking to pass that test, then we were looking to pass boards,
Mhm.
then it's like,
You let life
okay,
pass by.
yeah, it passed by, you finish school, and it's like, why did I why did I act like that? Why did I behave this way? Why did I put so much pressure on myself? Why did I judge all my classmates? Because
Yes.
at the end of it, it's done. You're a dentist. You're still called
Oh,
doctor,
yes.
regardless of where you are in the class or whatever, where you
Right.
rank.
Exactly.
And then you're entering the real world. And there's so many, I mean, I believe that there's so many misconceptions about dentistry as a career.
There.
Do you did you come across any of these misconceptions, and what was your experience?
Yeah, we medical profession students spend a majority of their life as a student. And not only is that difficult mentally, but it's also very difficult when it comes to navigating life after school, because you get stuck in a bubble of I'm just a student, I'm studying, this is what I want to do. I can't wait to make money when I graduate. Oh my God, yeah, this, that. And you leave, and then you're like, I just spent a majority of these crucial years of my life so consumed in one thing. And with that, I fear comes unfulfilled potential. And that's something that I want to reiterate over and over, because we have to remind ourselves that it's okay to dive into other realms, to not forget that your career does not define you.
Right.
And so misconceptions in dentistry definitely come along with that, because when someone graduates, they are automatically viewed as you don't know anything, especially to a potential employer. Now, of course, that is something that is pretty valid. I would say word for word verbatim, but when you graduate, you need experience to get to the next level. And the working individual experiences way different cases than in school. Now, we are all prepared very well for the real world, but of course, experience comes with it. And it's really hard for newer graduates to enter the workforce, because you don't know what you're getting yourself into, and no one really prepares you for that. And there are times where, yes, the misconception is you are only good for being a dentist, and now you have to be a slave to your profession, although you spent a majority of your adolescence or early adulthood studying. Now you have to continue, but in a different way. Now you have to be dependent upon yourself and a potential employer to navigate the remainder of your career and on. And it's a very difficult concept, because no one really prepares you for that. And so a lot of dentists and actually a lot of patients have misconceptions about their providers. If you see a younger dentist as a patient, a majority of the time they're thinking to themselves, oh, well, I don't think they know how to treat me. Well, it's a double edged sword because there are some older dentists who are close to retirement who do have so much experience, so much knowledge. But I will tell you, nowadays, if continuing education is not pursued by an older dentist, they are missing out on a lot of newer advancements and technologies that younger graduates do have the access to and experience with. So that's a misconception that I have experienced very frequently in dentistry, in addition to gender bias. So we can go all into that, but that's a huge part of it as well. I don't know if you've ever experienced it, but it's something that unfortunately still does exist. And I first experienced it in dental school, actually.
Really?
Yes, in clinic. My first patient ever.
Oh, wow. I mean, I haven't personally experienced it, but recently one of my colleagues, one patient came in, sat down, and as soon as she went into the operatory, he was like, "No, I don't want to see a female dentist,"
Yeah, it
and
exists.
then walked out.
It
So it
exists.
hasn't happened to me, but I've seen it happen to others. So I would like to hear this story actually.
Yeah, of course. So nowadays, a majority of um, professionals in the dental field are women. I think the statistic is like 54% now.
Right.
And I think it's an amazing thing. Now, there are still people who have their preferences and that's okay. But at the same time, to think that a female has different capabilities than a male, that's a whole different story. And so when I was in dental school, my first day in clinic, I was actually going to do a prophy on a patient. So this first time I'm doing something on a live human, even though it was just a cleaning.
I
Female.
remember my first cleaning. I was
Yeah.
nervous.
Can't
So
forget
nervous.
those things. Yeah. So this was my first patient. I forgot her name, but I can't forget her face. And I remember we have a big, um, I don't know if you're familiar with like Big Little and sorority system fraternity, but my school did it like that, where you have a fourth year student who
Hmm.
takes you under their wing. And so I was working with that fourth year dental student. And as a third year, I was working with their patients. I was introduced by a male fourth year dental student who was basically working with me.
Right.
And I got ready to do the prophy. I sat the patient down. I introduced myself. I was very excited. And she looks at me and she says, are you doing the cleaning? And I said, yes, I am. And I was so excited. And she looked at me like, can I talk to him, please? Because and then she brought him aside and she said, I want a male provider, please. And I just remember, she said it in front of me. I could still hear everything. I kind of just walked back. The fourth year dental student told me, hey, I don't know what to tell you. She wants a guy. She wants me to do her cleaning. And I went to my professor at the time and I let him know what happened. And then I kind of walked away and I started to cry. I actually started to cry. I didn't let anyone see me, but I cried because this was a profession I was so excited about, so passionate about, wanted to pursue since the age of 7. And then for my first ever patient in dental school, where I was about to do a cleaning,
Hmm.
to not want me to treat her because I'm a female really set me back. And
Right.
it made me forget about what I love about this profession. And unfortunately, those things still exist, but I find it less frequent. And in fact, women can have smaller hands, and so they might be more gentle. And so some patients prefer women now. And I think there's nothing wrong with having both providers. We still get the same education. I think it's a matter of who do you feel the most comfortable with as a
Right.
patient, because at the end of the day, your dentist should have a great interpersonal connection with you and should be willing to also teach you and help you with preventive care. So, yeah.
That really hurts. I mean,
Yeah,
what a I guess what a terrible way to start your clinical experience, right? Everyone's already on edge to touch a
right,
patient for the first time, to provide like gentle and good care, and then to have someone not want you is
right,
a little upsetting, and I
right.
don't blame you for crying. I mean, it's only a natural reaction when you're already that
Yeah.
tense. Yeah.
Because, we work so hard to get to where we're at, and we don't want anything as small as gender bias to affect us, you know?
Right. No,
Yeah.
absolutely. Absolutely. You mentioned that you've wanted this profession since you were 7
Yeah.
and you were passionate about it because there's a lot of beautiful qualities. What are those qualities that you admire about dentistry?
I love how dentistry it's a profession that you're able to see an instantaneous result, but not only an instantaneous result when it comes to cosmetics, but also you're able to work with your hands, you're able to be creative and artistic without disregarding a patient's health. And when I was in school and I was learning about the connections between the oral cavity and the whole body, that's when I gained even more of an appreciation for it. So, as a younger kid, I only saw the aesthetic outcome,
Hmm.
but it wasn't until I grew older and I learned more about the science and the human body that I was able to appreciate dentistry even more. So it's really, truly a wonderful synergy of health, aesthetics, and that's something that I love, honestly. And making people more confident, that is a huge part of it. And that's something that I really love nowadays. It's what gets me to work and motivated every day. And you know, it's not just about the external, it's also about the internal. It's about how a patient feels, it's about how they're taking care of themselves. And these are things that I also preach on my social channels. This is what I talk to with other people, colleagues. So it's all encompassing.
Right. One of my mentors said that you can't have a healthy mouth. You can't have a healthy body if you don't have a healthy mouth.
Right?
And it's true. Like the mouth is obviously, everyone thinks of dentistry as a separate science from medicine, but
It's
it's not.
not.
Your head is attached to the rest of your body. Your mouth is the beginning of the GI tract, right? So all
Yep.
of these are intertwined. There is a connection between
There is a
oral
connection.
health and systemic health, absolutely.
Exactly.
And it's really important for us as dentists to be able to educate our patients. And I think patient education is
Patient education
something
is
that
huge.
we don't emphasize a lot on because we're so focused on getting the procedure done that a lot of
Mm-hmm.
dentists miss out on the education aspect.
I
And
know.
and it's kind of sad, and I've seen your channel and I've seen you on Instagram posting about a lot of different tidbits about patient education, and I think you had a conversation with another podcast
Yeah.
about promoting patient education, and that's very important.
Yeah, patient education became such an important part of the medical profession, but I think it's really important for providers, not only in dentistry, but also in medicine, to be able to portray all their knowledge, but in a way that can connect to patients with plain terms. And because the reality is, patients don't have that basic knowledge. They just don't. And it's really up to us. It's our duty to help them with that. It's I'd rather be able to prevent a patient from getting a cavity than them coming into my office and me treating them and getting a production out of it.
Right.
So I'd rather be that type of dentist,
Hmm.
one who prevents, cares, educates, than just treat and patch.
Absolutely.
Yeah,
That I mean, we're headed towards preventive dentistry. All of this technology that you mentioned, all of
right,
these changes, they're all about promoting preventive dentistry, and so we really need to add the educational component to kind of
right,
reinforce all of that to make it effective, because otherwise, a patient comes in the chair and goes home and doesn't change their lifestyle, it doesn't change their habits. So well, then they're going home and they're going to be unhealthy
right,
ultimately,
one
right?
hundred
So, and we
percent.
don't want that. But before we wrap up, like, where are you practicing now, and how can people connect with you, and what channels are you on?
Yeah, I actually was practicing in New York City, but I recently moved to Miami in March, and mostly people can connect with me on Instagram. So it's at Dr. Melanie Rosalia. And I do have a dental page as well. It's all on my personal Instagram. So I do find a way to connect the personal and the professional. So that's where people can reach out to me and find more about me.
Fantastic. Thank you so much for your time. I appreciate it.
Thank you. You too. Thank you so much.